Hey, this is Doug Field, your co-host, along with Brent Macy. Welcome back to the segment of HealthCare Consumerism Radio. We're pleased to have joining us actually a regular guest, Evan Richardson, VP of Product with Grand Rounds. Evan, welcome back.
It's always great to be back. Thanks for having me again.
Yeah, nice to have you here. Evan, I know we'll focus most of the talk today around this new Employee Benefit Expectation Survey, but if you could take a minute and kind of you remind our audience or talk to our audience about what you guys are doing in this space and some of the innovations you have going on at Grand Rounds.
Yeah, absolutely. I appreciate that. So Grand Rounds really is the best way to ensure that folks get access to the highest quality health care available. And we do that by providing access to the top 0.1% of specialists to folks when they need it most. We put people in the office of the highest quality specialist for their disease in their area. And when they have a serious diagnosis, we gather all their information, put it on our cloud platform, and provide an expert remote consultation from one of the world leaders in their disease area, so that no matter what's happening, what stage of care folks are in for their health care issue, they can make sure they're getting the absolute best care in the world.
Excellent. Evan, tell us, you've recently completed a employee benefit expectation survey, and tell us a little bit about what that the methodology and what you were trying to accomplish, and let's talk a little bit about some of the findings, I think, which I find very, very interesting.
Yeah, absolutely. So, I think we wanted to understand how some of the changes that have been happening in America over the course of the past decade in the structure of the average family really impacted folks' beliefs about how benefits should or could work within an employer-employee relationship. And so we surveyed about 2,000 people from all walks of life in the U.S. In combination with Harris. And, I think one of the things that we found was perhaps not surprising. We all know that the structure of the average family is changing. There's a huge conversation going on right now about the sandwich generation. And, more than 47% of folks who are between the ages of 40 and 60 have an adult child and also have somebody who's in their 60s or 70s who they're helping to take care of. So there's a huge portion of the population who actually has this sandwich generation interaction where they're taking care of folks from different areas of their life. And that's not surprising.
And Evan, not to interrupt you, but to make a point, that's going to do nothing but increase. Wouldn't you agree?
Oh, absolutely. As the baby boomers continue to age and folks see their parents continue to age as well, and their children, many of whom are now moving back in as they get older, I think that's only going to continue to increase. And what we found with our survey was perhaps not surprising given that context. So 60% of the people we surveyed said it was at least somewhat important that health care benefits extend to a broader set of their families than just their nuclear family, that they extend to their parents, that they extend to their adult children. And perhaps really surprising here, 68% of people in our survey said they'd be more likely to take a job that offered access to expert second opinions to their extended family. And so to us, that was surprising because historically the notion that benefits would extend beyond your nuclear family just wasn't on the playing field, but it really is starting to change.
Yeah.
Now, Evan, why was that benefits wouldn't extend past the nucleus of the family? Is there a specific reason? Cost?
Well, I think you're absolutely right. Look, cost is a huge one, and I think as you look at what's likely to happen, I think that the core healthcare benefit, insurance, it probably isn't likely to extend beyond the nuclear family for a little while. It's just too darned expensive. Mm-hmm. But I think that there is going to be a pretty significant shift in a lot of benefits that lever existing core benefits. So, many older parents who may have moved back in with an adult child and who may be receiving care from a sandwich generation individual, many of those folks, of course, are covered by Medicare. But it's often hard to make sure that they're getting high-quality care when they are covered. So, something like Grand Rounds really helps to lever their existing benefit, make sure they are getting the highest quality care without imposing the cost of that care on the adult working child's employer, right? So it's actually an interesting way to lever existing benefits and make them a heck of a lot better without imposing a huge cost
Evan, with that trend to go to extend out to others outside of the family nucleus, do you see that with the public exchanges? Do you see that trend taking place in the public exchanges that are going to roll out next year?
I think that's a great question, and I think we'll a little bit have to see. It's so early in the life of the public exchange that I think we're probably going to see those evolve, and I wouldn't be surprised if there was an extension of benefits that at least was an option for many folks. Whether or not that became a popular option, again, given cost, I think that's always something we're going to see as it evolves.
Yeah, and Evan, per your survey, it said more than 1 in 4 respondents they wouldn't know how to find a qualified medical specialist for a serious illness. Why do you think that is?
Yeah, I think that's a fascinating number, and perhaps not surprising for folks who have spent a lot of time in the medical world, who understand how complicated it is to find a qualified medical specialist. Historically, folks have said, I'm just going to take whoever it is that my primary care doc suggested I go to, and as a result, people will spend more time looking for a new flat screen television or deciding, which sofa they're going to buy, than they will looking for a specialist who's going to carry out a complex operation or who's going to treat a serious illness. And at its core, that's because people don't have the right tools to really figure out who those physicians are who are at the top of quality of their field. And that's an area where we step in and try to say, great, we'll help you with that decision. Right. We'll make sure that you're much like an insider when you're making those decisions. We'll help you to find the real top quality specialist in your area or nationwide.
Well, Evan, what other really interesting data points did you see come out of your survey?
Yeah, I think we've talked a little bit through the importance of benefits extending more broadly, and that was pretty darn consistent. But another thing that we found that was pretty interesting was people's recognition of how important it is to get high-quality care. Almost 40% of survey respondents said they would travel anywhere in the nation to find a leading expert in their disease area if they or a loved one was sick. And so I think, what we're seeing is a recognition of the importance of high-quality care, a recognition that the definition of the family has changed a little bit. And as a result, I think we're going to continue to see people who are really going out of their way, employees who are spending a huge amount of time making sure that their family members get the highest quality care. And, coming back to why it's important for employers to provide those broader benefits, when your employees are spending a lot of time making sure that their family members, whether they're adult children or whether they're parents who are aging, are getting the highest quality care, that's an impact to the employer as well. And so, I think it's going to be really important for these employers to start helping their employees make the right decisions with their health care.
Evan, what's been the as you and your team members run this by employers across the market, what's been their kind of feedback?
I think it's really interesting. The folks that are our customers today, and we cover more than 1 million employee lives, the folks that are our customers today see this benefit and see the opportunity to expand a benefit like this to their employees' extended families as being really key. They see it as a low-cost way for them to really say, you know what, you, the employee, are important to us, and we recognize that your family, your extended family, is important to you, and we want to do everything that we can to help. And so, our core customers, folks like Hightail, folks like Wealthfront, many large companies, sit there and say, this is a great way for us to differentiate ourselves in the talent wars and make sure that our employees understand we're offering different benefits, differentially positive benefits that will really help them if anybody in their family gets sick. So the reaction has been extremely positive, which has been great to see.
And what's the, we have all of us have the cloud over our heads called ACA. How's this all fit in and around ACA, Obamacare?
Yeah, absolutely. I think in some ways, some of the core tenets of the ACA, that is attempting to expand access to care, really working to ensure that folks get access to quality care, are some of the same goals that we share. I think we attack it in a very, very different way. And that is to say, we will ensure that you get access to the highest quality care, regardless of of your network, regardless of your coverage, et cetera. We'll make sure that somebody who is a real expert gets access to your case and can see you and diagnose and give a treatment plan. Because at the end of the day, we know, we've seen it in study after study, we know that higher quality care is lower cost care. And so in the same way that the ACA focuses on improving access and driving down costs, regardless of what somebody might think about the implementation, we are sort of there philosophically too, but attacking it from a very different way.
Mm-hmm. Now, Evan, we're all walking into open enrollment in the next 30, 45 days. What employers today are now looking at building out and you alluded to it, building out very robust plans so they can attract and retain the talent that they have. What's the value that employers continue to look at how they build out their plans to best serve their employee populations?
Well, I think a lot of employers are constantly looking for innovative ways to provide new benefits to their employees, and they're looking for cost-effective ways to really make a difference and to really be seen by their employees as making a difference. And so I think, one thing that we're going to continue to see are benefits like Grand Rounds that really are highly leveraged, that really help folks to say, great, we recognize what's important to you, and we want to help you to take care of everyone who is important to you, everyone in your extended family. With nearly half of adults in their 40s and 50s, as we talked about before, having this sort of sandwich generation effect going on, with nearly 15% of those folks providing financial support to an aging parent, it's incredibly important that employers start to think about how they can help their employees take care of those people who are most important to them. So I think, as we move into open enrollment, that's one of the things that we're going to continue to see, not just this year, but really going forward.
Right. Evan, we've got about a minute and a half to go, and I want to give you guys a chance, and it's been great having you on the program again. Kind of leave our audience with, 2 or 3 takeaways that you, for them, please.
Yeah, absolutely. I think the key takeaways that were so surprising to us are that people's expectations really have started to change. Mm-hmm. That more than half of their employees today are likely finding it really important that some of their benefits extend to those employees' extended families. And as they think about attracting new talent, one of the ways that they can really start to differentiate is by offering benefits to that broader set of family and offering levered benefits that have an incredibly high impact for their relatively low cost in comparison to something like extending actual health insurance to that broader population. And so I think a lot of these tools are going to be important to differentiate employers from other folks. And when you have a number like 68% of employees saying they'd be more likely to take an offer from a company that extended benefits to their extended family, I think that's pretty powerful. And so I think that a lot of folks should keep that in mind as they think about their benefit design in this coming year.
Yeah, that's very interesting. Evan, listen, we thank you very much for joining us. And to our market and to our audience out there, stay tuned for the next segment of HealthCare Consumerism Radio.